body. The red is the arteries, blue is the veins. So starting with the circulation to and from the fingers. Blood flows from the left ventricle into the aorta and into the brachiocephalic artery, then into the subclavian artery, blood continues from there to the axillary artery near the armpit, through the brachial artery in the upper arm, through the radial and ulnar arteries. So ulnar artery is near the pinky and radial is near the thumb in the forearm, to the palmar arches, which is this here, and into the digital arteries of the fingers, these here. Blood returning from the fingers to the heart starts in the digital veins, and through the venous palmar arches here, into the radial and ulnar veins. Again, radial is by the thumb and ulnar is near the pinky. It continues through the brachial veins, which are these. The draining blood from the arm includes the cephalic vein, which is this side, which travels along the lateral side of the arm from the wrist to the shoulder, and the basilic vein, which is this side, where it joins the brachial vein to form the axillary vein near the armpit. The cephalic and basilic veins are connected near the elbow by the short median cubital vein. Which is here. Which is where people normally get IVs. From there, that flows up to the axillary vein and continues through the subclavian vein into the superior vena cava, which carries the blood into the right atrium of the heart, which is right in there. Circulation to and from the toes. Blood flows from the left ventricle into the aorta and through the descending aorta to the common iliac artery, which is here. From there, the blood flows to the external iliac artery, which is down here, to the femoral artery, here, into the thigh, and continues through the popliteal artery down here, behind the knee, where it branches into the anterior and posterior tibial arteries. So anterior and posterior in the back. Then blood flows through to the dorsal pedal artery here. and into the digital arteries. Blood returning from the toes to the heart starts from the digital veins and flows through the venous arch and to the anterior and posterior tibial veins. So here's the anterior and posterior in the back. Then it goes to the great and small saphenous veins. This is the great, and in the back is the small. Where it joins at the knee, where the popliteal vein is, and that flows to the femoral vein, to the external iliac vein here. Then blood flows to the common iliac vein, here, and up into the inferior vena cava to the right atrium of the heart. Circulation to and from the head. Blood flow begins in the left ventricle of the heart to the aorta and directly to the left common carotid artery. Or through the brachiocephalic artery to the right common carotid artery, which would be on the opposite side. The common carotid artery branches into the external carotid artery that supplies the face and the internal carotid artery blood to the anterior circle, which where the arteries connect up inside. Which would be the basilar artery. The vertebral artery branches from the syclopian artery here. Blood leaving the brain collects in dural venous sinuses and into the internal jugular vein, which would be this one. And continues into the brachiocephalic vein down here. Blood from the face travels through the external jugular vein, this one, to the brachiocephalic vein. And then the brachiocephalic vein carries the blood into the superior vena cava, which drains back into the right atrium of the heart.